really completely and totally warms my heart, because he had said that out here there's going to be a Ronald McDonald House being built. And we're already started to see, like, beautiful, like, we're really involved in it downtown, and it's one of my favorite organizations. I absolutely love it. But for a little, like, same premise from what you're doing here, like real emotional support for families, just completely different stage of life. But it's also fantastic. I loved kind of the stories you guys get. So today, what we're going to talk about, kind of in a nutshell, CHF, end of life disease. You guys are the advocates for kind of the family to be able to disconnect. You guys also are kind of there unplug, and you're also the model for everybody else that you touch. So for the American Heart Association, we're going to talk a lot about like just congestive heart failure, how that all happens, what's behind it. We'll share stories about what exactly we can kind of do about it, what's kind of weird about it, what's not, what's good, what's bad, that kind of thing. When it pertains to kind of end of life, we'll also go through kind of Life Simple 7, which is a concept developed by the American Heart Association about healthy cardiac living, and that having to do with you guys and everyone else that you kind of touch, okay? Not necessarily for those that we support within hospice. However, for everyone else, it's kind of the newly developed thing by the American Heart Association that they'd love to get the word out on. So, we're going to go ahead and we'll hit it. So, I'm a cardiac anesthesiologist, so American Heart Association and whatnot, very close to my heart when it comes to that kind of stuff. We have a foundation. What we do, we go around the world, we train people how to save lives. So that's what I do in my spare time when I'm not doing cardiac anesthesia. So that's the guy who kind of is the person who keeps you safe and comfortable while you go off to sleep for your heart surgeries. I'm that guy. So hearts and that kind of thing, really, really super important to what we do. So, go ahead. So, basically what we're going to talk about today, there's a little guide at this point. It's called Life Simple 7. It talks about the key 7 things that will make it to where you have better quality of life, less likely to have knee surgery, less likely to have kind of all the untoward effects that can happen to get you to kind of the number 1 and 3 killers, which are kind of heart disease and stroke. Okay. So very basically, the American Heart Association has a big goal. From 2000 to 2010, they decreased the amount of heart disease that's actually in the United States by up to 38%. Was decreased during that time period. Either through initiatives they did, advances in kind of medicine in general. Over the next 10 years, which is 2010 to 20, they would like to reduce 20% mortality morbidity. The key thing that they think that will actually make that happen is kind of adherence to the Life Simple 7. All right, so Clive is the chief medical officer of the AHA. What he says is very basically that if you can kind of master these key 7 components, they're not like a cool 7, these are good 7, there's usually 10, but usually 7 to only worry about. By just these 7 alone, if you can master them by age 50, it pretty much says you can have 40 years beyond that point of cardiovascular-free challenge. So that's usually the time period when people start to develop cardiovascular disease. It develops younger than that, but that's when kind of the effects are most likely seen. If you can master these 7 by then, you can get 40 extra years. So it's pretty actually compelling research that he has on it. All right, so how does this relate to congestive heart failure? Congestive heart failure is at the end point beyond cardiovascular disease. It's once we get kind of past cardiovascular disease level. Okay, what causes it? Coronary artery disease. Infections. Infections can also affect the valves. Once the valves are affected, the heart is basically, when it squeezes, not as much blood is going out from what it was before. So you have to have functional valves, and you have to have functional squeeze. Like a lot of things can make the functional squeeze not be as good as what it was before. Anything that damages that muscle. Heart attacks, ischemia, any areas where like alcohol can leave it to where it gets very ischemic, it gets large, it gets ballooned out, to where it can pump, but it just doesn't actually push as much fluid anymore. When that happens, you have fluid overload throughout the entire body, okay? Everything from puffy fingers, hands, notice in the feet, just extra fluid that's on. Worse is when it kind of starts going to the lungs. Okay, it's kind of the last place, but that's when you have kind of the really deep cough, and you can tell that there's a lot of fluid that are on the lungs. That's kind of the end stage of congestive heart failure. Okay, and that's all just secondary to the heart not being as effective at actually squeezing and being the pump to the system, in a nutshell. Okay. All right, so we kind of talked about a little bit what causes it. Now the risk factors for those. So if you dovetail it back again one layer, what actually is behind kind of heart attacks, coronary disease, you have life symbol 7. That's actually the things that are at the base of all of these. So hypertension, smoking, prediabetes, eating poorly, all of those kind of fit into the actual root cause of congestive heart failure. So they have a cool app because they have cool apps for everything. And so My Life Check is just another one of the cool apps that the American Heart Association has. You can go in, you enter your data, it spits out recommendations on what it is that you can do. Very actionable and very easy, because a lot of times it can get really, really confusing. You hear a lot of different things, like, oh, well, no, red meats are bad. No, protein is good. Eggs, they're good. No, but you gotta hold the yolk now. You can't do the yolk. Like, skim milk, no, we don't want any milk anymore. Like, all dairy is bad. It's like, it can be a lot of different things. Like, you get a lot of different literature all coming from a different area. It leaves you kind of like a deer in the headlights, but you don't really know what the heck you're supposed to actually be doing. By focusing on just 7 things, it makes life a little bit easier when it comes to health in general. So, I like to simplify things if possible. So, first thing, blood pressure. By far and away easily the kind of cornerstone. The biggest challenge, blood pressure, is asymptomatic. You're not going to feel it. I asked my dad 2 months ago, hey, how's everything going with your blood pressure? You checked it recently? Now I was feeling so good, I stopped taking the medication. I haven't checked my blood pressure since. It's good. We're in good shape. I think that one's good. That's not the proper response for blood pressure, okay? Like, it's not something you're going to feel until it's way too late at that point. Headaches, that kind of thing, that means you're almost at the stroke level, okay? You've already caused a lot of atherosclerosis at that point. So by that point, it's not in a good place. The only way you can really know how you're doing here is you have to know your numbers, you have to get it checked, okay? So this goes for you guys and like pretty much everybody else in your family. Like, if they kind of, don't want to take it for whatever reason, there's plenty of medications, there's plenty of ways that you can actually decrease blood pressure, but it's an easy, modifiable challenge. Getting active. A lot of these are interrelated, as you'll kind of see, because getting active actually helps out with, I think, 5 or 6 of the actual 7. So a lot of them are interconnected, which is nice, because by taking care of one, you take care of multiple, okay? Now, strangely, getting active, that's 150 minutes per week of moderate activity. That's it. That's 30 minutes, 5 days a week. Chop it up however you would like. Only 10% of Americans actually get that. 10%. That's a really, really, really small amount of people actually get that. And women, in case you're wondering, like, does this affect you or is it only guys? Since 1984, there's more women with heart disease than guys. That's since 84. That's a long time now. So that's why, has anybody heard of Go Red for Women by the American Heart Association? That was the whole outreach and awareness of that. There's an amazing amount of heart disease that affects women, and it's sometimes thought of as kind of a male disease. The guys get heart disease, they get heart attacks. Women don't have to worry about that because women are usually worried about taking care of everyone else, right? So, take care of yourself too on this, okay? So, checking your cholesterol. Only 25% of cholesterol actually comes from what you eat. So the rest has to do with genetics. So you have to know your numbers here too. You can affect it a little bit through what you eat, a good amount actually, through what you eat. However, if you need to take medications for this, sometimes that's the only way to get it down if you're genetically predisposed to having high cholesterol. Cholesterol can kind of accumulate in areas you don't want it to, breaks off, goes downstream. That's what causes heart attacks. That's what causes kind of the narrowing of the vessels that causes the ischemia. Eating better. I say a lot of these fit together. So, what they're saying here, try to steer clear of sugar-enhanced fluids. Everything from Coke, anything high fructose corn syrup, they can pack an awful lot of carbohydrates and simple fluids, or simple sugars, into just different drinks. It's an easy way to hide a lot of very bad things for us. Okay, the more processed the food is, usually by and large, the worse it is for us. So anything that's fresh, raw, vegetables, fruit, whole grains, all that, still considered good. Fish and their omega-3s, also considered very awesome. I'm sure you guys will have questions about this later, so I won't spend a ton of time on it right now. Losing weight. So this goes back to the BMI. BMI is a calculation of your height and your weight. Okay, they use the metric system, which we commonly don't here in the United States. They do it for all of their good studies, but again, it makes it completely and totally arbitrary on what 25 is. Do you know what your kilograms over meter squared is? Unlikely. So luckily, Google can figure it out real quickly for you by just typing it in. But it's relatively kind of a pain for us to kind of know exactly where we are on that, okay? But with weight reduction comes a lot of the other things synergistically all working together. Again, blood pressure. How do you actually decrease weight? By eating well and staying active. We just mentioned 3 of the other 7s, and that, like pre-diabetes is one of the other ones that also goes down with weight control. So all these are relatively interconnected, which is great, okay? So smoking. This is kind of the one outlier on the whole thing. A very modifiable risk factor. You start to heal from smoking as soon as you stop smoking. So literally as soon as it stopped, the body starts repairing itself. So I get a lot of patients, because I do lung and heart surgery, they're like, listen, I've smoked for 20 years. It's not going to make any difference at this point. My lungs won't repair themselves. You can have a lot of reasons to not smoke or to continue smoking, but that shouldn't be one of them, because your lungs will repair themselves. Okay, short of like very end-stage emphysema, they can repair themselves relatively well. They have all the building blocks. They can repair. It's just one of those things you need to stop. And they have multiple ways you can do it now. They have medications, they have counseling, they have support groups, they have all kinds of stuff. So if you know anyone who actually wants to quit smoking and is still smoking, there's plenty of help for them. So please don't hesitate to get them over for that. So, blood sugar. This is the prediabetes I was telling you about. Like, as you get older, usually you've heard of kind of type 2 diabetes. What usually happens is your body becomes more resistant to the insulin that's actually released by the pancreas. Okay? In contrast to type 1 diabetes. Type 1 diabetes has to do when your pancreas isn't giving out any insulin. At that point, that's a little different in the way of treatment. What usually and most likely happens is what we call syndrome X. You start to get a little overweight, you start to get high blood pressure, you're not being active, and you're eating too much. We've already covered 4 over here. What happens? Your pancreas is throwing out insulin, but it can't keep up. Therefore, there's extra sugar around. Sugar coats your red blood cells. Now it becomes very sticky. It sticks in a lot of places you don't want, like in arteries, veins, any of the small vasculature. When it sticks in there, that's when you have ischemia, because as soon as it kind of sticks and blood can't get past it, all of a sudden, whatever that was feeding, that is no longer getting fed any nutrient. Okay, so that's what we talk about when congestive heart failure, when the heart just can't squeeze as much, it doesn't have as much good muscle around it that can actually support itself. So, in a nutshell, the reason we have Life Simple 7 decreases the likelihood of illness, heart disease, increases your quality of life, all that good stuff, all in one nice little plan. So, basically, it's a basic success plan. You can go online. They have it there. Please share it with whomever you guys kind of touch, hang out with, and stuff like that. It's a really great tool to kind of help. And that's it for the scheduled programming. Now I have time for questions for you guys. Throw out any questions you have about congestive heart failure, like what you're seeing in your kind of daily life, anything, questions about the presentations, any of it.